This show is being recorded on Monday, the 1st of March 2021. Hello everyone, I am Mary Holt and welcome to our first update show following our special show on Covid-19 and vaccines, which was broadcast on the 4th of February 2021 and is available on our YouTube channel. Hello Gary, thank you for making the time to update us. Would you like to introduce yourself again, please?
Hello, Mary. My name's Dr. Gary Brook. I'm a semi-retired doctor who specialised and still does specialise in infectious diseases. And amongst other things, I work in a vaccination centre.
This show is much shorter than our previous one, so we're just going to whiz through some questions. I think we've got about 7 or 8 sections to go through. So let's start with, is there any more information about the effectiveness of the vaccines?
There's a great deal more information about the effectiveness of the vaccine. I'm very pleased to say, even today, Matt Hancock gave a press briefing from Downing Street talking about the so-called real-world effectiveness of the vaccine. In other words, how well the vaccine has been working in the, so far, 20 million people who have been vaccinated now. And what it shows is that after a single dose of either the AstraZeneca or the Pfizer vaccine, you get remarkably good protection, much more than even we could have hoped, I think, because there was always this question about whether a single dose was going to be as good as 2 doses. But the evidence from both Public Health England, from Public Health Scotland, and research from both Oxford and Cambridge universities have all shown that there is a high degree of protection from a single dose of vaccine. We're talking in terms of overall 85 to 95% protection against hospitalization and death. And even in people over the ages of 70 or over the ages of 80, we're still getting protection against hospitalization and death in the ballpark region of about 75 to 85%. And in addition, 2 other important questions have been answered. The first is that the single-dose vaccine still does protect against symptomatic infection. So there's a drop-off in symptomatic infection with a protection rate of around about 70%, 60-70%. But more importantly, there is protection against infection full stop. And we're seeing protection against infection in the area 50 to 75%. And as I said in my first program, if you can't catch it, you're not going to spread it. So remarkably good results already from just a single dose of the vaccine.
That's fantastic. Do you think policy will stay to do the second dose? Because they sound such high numbers. Why wouldn't you just stay with the first dose and then therefore do more people?
I think that we don't know how long the effect of the single dose is going to be. So whilst we've got remarkably good data about 2 months out from a single dose, we don't know how long that effect is going to last. So I think it would be pushing it to extend it beyond the 3 months. And in fact, next week, the 8th of March, is when the officially second doses are about to start. So in the vaccination centre where I work, we're offering second doses from next week, and we're going hell for leather to give the second doses. So we're going to give roughly double the amount of vaccine in a day that we used to give. And that also allows us to give first doses to anybody else who wants them. Because the still unanswered question is, how long does the effect of the vaccine last? Not only the first dose, but the second dose. And I think at best guess it's 6 to 12 months, but it could be longer. Of course, we have the other issues of variants, which I'm sure we'll talk about later.
Is there any new information about the side effects from the vaccines?
I think what we found in the clinical trials has been shown in real life. That is that the vast majority of people vaccinated only get minor symptoms. There's a study from the Zoid COVID-19 symptom checker study, which showed that about 60% of people given the Pfizer vaccine got virtually no side effects. About 40% got pain and swelling in the arm, and about 15% got headache and fever and flu-like symptoms. We don't have yet enough data about the AstraZeneca vaccine, particularly from that study. But if you look at the MHRA, the Medicines and Healthcare Products Regulatory Authority, they have shown a slightly increased rate of side effects of the AstraZeneca vaccine compared to the Pfizer vaccine. It's not huge, but there appears to be about a 10% higher rate of side effects with AZ compared to Pfizer. What's also interesting is that we do see anaphylaxis, this quite severe reaction of immunity or reaction to the vaccine leading to collapse, which is cured by a single injection of epinephrine. And we're seeing that in AstraZeneca as well as we are with the Pfizer, albeit at very low rates. So even though we've got nearly 20 million people vaccinated now, the number of people reported with anaphylaxis is only about 200 with the Pfizer vaccine and around just a bit over 100 with AZ. So everything we've seen so far is precisely what we would have expected, perhaps with a small signal that we're getting a little bit more side effects with the AstraZeneca vaccine than the Pfizer, but not much. They're both very good vaccines and both give you few and relatively mild side effects in the main.
And maybe, and we don't know yet, maybe the Pfizer one at the second dose might make symptoms and the AstraZeneca might be less symptoms. Could that be possible?
Certainly the warning, and I haven't seen that much evidence, but the warning has been that you would expect to see more side effects with the second dose than you would with the first dose. And that was particularly stated for the Pfizer vaccine. As it happened, I had my second dose not too long ago and had absolutely no side effects at all. My first dose, I had a sore arm. My second dose, I didn't even have a sore arm. So it's going to be very much according to the individual, but it's not something that people necessarily should be worried about.
Is there any further news on the variants?
Again, here we are on the 1st of March, and the big news is the Brazilian variant P1, where 3 people in Scotland, 3 people in Gloucestershire, and 1 other person somewhere else in England have all been found to have the P1 variant. And what we don't know about this variant is how it's going to be different both to the Kent variant, which is most prevalent in the UK at the moment, the South African variant, which we're seeing relatively more commonly, but still quite rare, and other variants. So the fear is that it might be as infectious as the Kent and South African variant, but more potentially worrying is that it might evade vaccination. In other words, that people who are vaccinated might not be protected quite so well from the Brazilian variant as the other 2, but that is entirely unclear. There is some evidence that that might happen, in as much as in Manaus, where the Brazilian variant started, people are reportedly getting second infections quite commonly. So that would suggest that the infection first time round with the original strain didn't protect so well against the second infection with the P1 strain. But the data for that is not particularly strong. So we'll just have to wait and see. And as I said in the first program anyway, the beauty of the AZ and the Pfizer and the other vaccines is that they can be manipulated very quickly. So within a matter of a couple of months, we could have a new vaccine available, which will be able to deal with new variants such as the Brazilian variant if necessary. But that's a long way off yet. It may well turn out that the vaccination that we've got, particularly after the second dose, may be good enough against the Brazilian variant. And I suspect that that will be the case.
What is the new information about the vaccination rollout? For example, the numbers already vaccinated, timetable, second doses, if asthma's included, all that sort of thing.
So we're up to 20 million first doses now and about 500,000 second doses, I think, or thereabouts. So the vaccination program is going as planned, and we're still on schedule to have finished all the 9 risk groups by the middle of April. So we're at about 6-7 in the risk groups. There has been some changes since we last talked. So, for instance, mild asthma has been confirmed to be not part of the 9 risk groups. So if you've got asthma, you can only be prioritized if you're taking oral steroids or have been hospitalized. However, the government have increased the number of people who have been advised to shield, and therefore the number of people who can get the vaccine early. And that includes people with severe learning difficulties, people with HIV, and a list of other illnesses. So there has been quite a bit of change there. We've also had some information about how the rest of the population is going to be vaccinated. So somewhere from the middle of April, when we've got through the 9 priority groups, people are going to be offered the vaccine on a strictly age-based schedule. So it'll be people from 40 to 49, 30 to 39, and then 18 to 29 as the 3 next groups. So they hope to have offered everybody in the country a first dose by July, and therefore by extension, a second dose by October.
Are there any new treatments for COVID-19?
I did briefly mention the monoclonal antibodies in the last programme, and there is one now that's just being shown to be definitively effective in addition to steroids, which is good news. So these are treatments that are used for rheumatoid arthritis, because rheumatoid arthritis is a condition where your joints become inflamed as a result of overreaction of your immune system, and monoclonal antibodies damp down your immune reaction. And in the same way, the reason why people become ill with COVID is not necessarily the virus itself, but your immune system overreacts to the virus, and it's the inflammation by the immune system that causes the severe effects, such as the pneumonia. And there's a new monoclonal antibody, teclizumab, which is an antibody against one of the signal chemicals involved in inflammation. And that gives you about a 5% additional survival benefit over and above steroids. So that's good news. There's some concern from earlier smaller studies that this wasn't working, but more recently it's been found that it definitively does improve people's chances of survival over and above the use of steroids. And again, a big shout out for the NHS, because it was a multi-centre study in the NHS that found this.
I'm going to go into some audience questions now. I have a friend who had the Pfizer dose on the 16th of January, but developed COVID-19 symptoms on Sunday, the 21st of February. So I think that's 4 to 5 weeks later, with a high temperature and dizziness. And she tested positive on the 22nd of February. We wanted to know what happens in terms of immunity to the people who get COVID-19 after their first vaccination, and should they change the timing of the second vaccination?
So what this lady demonstrates is what I've been saying all along, that vaccination doesn't prevent COVID entirely. What it does do is reduce your chances of getting COVID, and also reduces your chance of getting severe COVID. So I'm glad she wasn't hospitalized. I'm glad that it wasn't, by the sounds of it, much worse than a flu. We are seeing people after the first dose, particularly, that the risk of getting a flu-like illness or getting symptomatic COVID is greatly reduced, but some people will still get it. What we do know is that in people who have had COVID and been vaccinated, it's pretty much like you've had 2 doses of vaccine. So it's usually the other way around. People had COVID first and then given a first dose of vaccine. And the first dose of vaccine was essentially acting like a booster from your first COVID infection, which was like your primary injection, if you like. So it's relatively uncommon to do it the other way around, but I'm sure the effect is still the same. So her immunity now would be pretty much the same as someone who has had 2 doses of vaccine. And in fact, some people have started to argue now that if people have already had COVID and have had antibodies, then they should only be given 1 dose of vaccine. But that's not official yet. So until that's official, I would say go ahead and have your second dose of vaccine after 3 months. I don't expect that you'll get severe side effects from the vaccine. I can't guarantee it, but I don't expect that you would.
And then our final question is, a large group of 60s to 65s seem to think they've been missed. Could there be a data set being missed because people above 65 are being called and then people lower than 60 are being called in this area?
What I do know is that this week, the letters have just gone out to 60 to 65s. So the first week in March is when the letter went out to 60 to 65. So if people have not received a letter already in that age group, they should do in the next week or so. And in fact, they don't even need actually to receive a letter, because if you go onto the vaccine website, it will allow you to book an appointment for vaccine if you are age 60 or over. It should allow you even without a letter. People below the age of 60 have been vaccinated, but normally for one of several reasons, i.e. that they appeared in the 9 risk categories. So either they're a health and social care worker, they had a illness that classified them as extremely vulnerable or vulnerable, that they were a carer. So anyone who receives carers allowance were group 6. And so irrespective of their age, they would have been offered the vaccine. But I have heard stories, and I don't encourage people to try these stories out, but people accompanying people in the 9 risk groups to vaccination centres, being invited to have a vaccine themselves, particularly even though they hadn't booked, particularly if there were some doses of vaccine left at the end of the day, which inevitably there are, because vaccines come in vials of 11 doses for AstraZeneca or 6 doses for Pfizer. And therefore, once you've got through all your list of people to be vaccinated, you inevitably end up with a vial with a few doses left. And then you have to seek out anybody who wants to be or needs to be vaccinated. And as I described in the previous program, we have a list of people who have left us their telephone number, and we usually ring them and they will come in at short notice and we offer them vaccine. But there are other ways, because the vaccination centre I work at is in a hospital. Actually, we just go and ring around the wards or ITU or accident and emergency and say we've got some doses left. If anybody wants to come and get a vaccine, you can do. And because they're all healthcare workers, then they're automatically eligible for immediate vaccination anyway.
So that's it for this update. Thank you again for your time, Gary. And maybe we'll be back for an April update too.
It's a pleasure. And things are changing so fast that I wouldn't be at all surprised if we have to do it all over again in a month's time. But really nice to do it with you and hopefully summarise the information that a lot of people have heard in the news recently.